Okay, hello everybody. This is Sharonda, and this is my Spreaker Studio. And let me make sure I get recorded on my Spreaker Studio. Okay, just a moment. Okay, so this is Sharonda. This is my Spreaker Studio Health Matters, as well as the Holistic Health Approach, which is on my YouTube channel. And in this particular podcast, I go over your chronic care conditions and ailments. And I take information off of reputable websites such as Mayo Clinic, CDC.org, the Johns Hopkins medical website, to name a few. So today's topic, I'm going to speak on chronic sinusitis, which is something I feel like I suffer from. And I feel like I had a bout with that later. And so this what prompted me to speak on this topic, because I do feel like during these times where we're concerned with the COVID and flu and things of that nature, this will be beneficial to those individuals who are suffering from allergies and respiratory issues this time of the year, and perhaps throughout the remainder, year round is what I'm getting at. So it says chronic sinusitis occurs when the spaces inside your nose and head are swollen and inflamed for 3 months or longer despite treatment. The common condition interferes with the way mucus normally drains and makes your nose stuffy. Breathing through your nose may be difficult, and the area around your eyes might feel swollen and tender. And I find myself I'm like this, oftentimes when I lay down, wake back up, particularly in the morning, my face is real puffy, my eyes are real puffy, and I feel inflamed. And so I do typically wear contacts, and sometimes I'll sleep in the contacts, I admit, which is not a good thing. So basically, it's the body's response to some type of allergies. So it says chronic sinusitis can be brought on by an infection by growths in the sinuses, which are called nasal polyps, or by swelling of the lining of your sinuses, also called chronic rhinosinusitis, the condition that can affect both adults as well as children. Common signs and symptoms of chronic sinusitis include nasal inflammation, thick, discolored discharge from the nose, runny nose, drainage down the back of the throat, postnasal drainage, blocked or stuffy congested nose causing difficulty breathing through your nose, pain, tenderness, and swelling around your eyes, cheeks, nose, or forehead, reduced sense of smell and taste. Other signs and symptoms can include ear pain, headache, aching in the upper jaw and teeth, cough or throat clearing, sore throat, bad breath, as well as fatigue. Chronic, and I'm assuming, with the fatigue, because if you're not able to, breathe through your nose, oftentimes you're not able to get the oxygen that you need, the oxygenation that you would need, and that pressure as a result can lead to other conditions. But I have the healthcare background in healthcare. I am not medically trained, meaning I'm not a medical doctor nor a nurse practitioner. But once you are living through these things, you can kind of like get the critical thinking skills going and know, okay, this is as a result of this. This is the reason for this. So I'm going to assume that a lot of that fatigue is as a result of not getting the oxygen or the ventilation that you would need. Chronic sinusitis and acute sinusitis have similar signs and symptoms, but acute sinusitis is a temporary infection of the sinuses, often associated with a cold. The signs and symptoms of chronic sinusitis last at least 12 weeks, but you may have several episodes of acute sinusitis before developing chronic sinusitis. Fever isn't a common sign of chronic sinusitis, but you might have one with acute sinusitis, is what it says. So pretty much what it means is if your body is used to this condition over time, it begins to adapt to that situation, okay? So when to see a doctor, you want to schedule an appointment. If you had sinusitis a number of times and the condition doesn't respond to treatment, you have sinusitis symptoms that last more than 10 days, or you're taking over-the-counter medications or as such, or even if the doctor have prescribed you medications and it still is not working, then it's time to go see the doctor or to go back to the doctor, okay? And notify your doctor if you're not responding appropriately to treatment. Now, this is here it says, see a doctor immediately, which can indicate a serious infection. So if there's a fever, swelling or redness around your eyes, severe headache, forehead swelling, confusion, double vision, or other vision changes, and stiff neck. Causes. What are some of the common causes of chronic sinusitis? So we have nasal polyps. These are tissue growths that can block the nasal passages or sinuses. A deviated nasal septum. A crooked septum, the wall between the nostrils, may restrict or block sinus passages, making the symptoms of sinusitis worse. Other medical conditions, the complications of conditions such as cystic fibrosis, HIV, and other immune system related diseases can lead to nasal blockage. Respiratory tract infections. This is infections of your respiratory tract, most commonly colds, can inflame and thicken your sinus membranes and block mucus drainage. These infections can be caused by viruses or bacteria. You have allergies such as hay fever. Inflammation that occurs with allergies can block your sinuses as well. What are the risk factors? So the risk factors is a deviated nasal septum, nasal polyps, asthma, aspirin sensitivity, a dental infection, a fungal infection, tumors, and immune system disorders such as HIV, AIDS, or cystic fibrosis, hay fever, or another allergic condition, regular exposure to a pollutant such as cigarette smoke. Complications, some of the complications, if left untreated, can lead to vision problems. If your sinus infection spread to your eye socket, it may cause reduced vision and possibly blindness that can be permanent. Infections, uncommonly, people with chronic sinusitis may develop inflammation of the membranes and fluids surrounding the brain and spinal cord, which is meningitis. An infection in the bones, or serious skin infection. So sinusitis, like any infection, if it's chronic or ongoing, it can lead to other infections and possibly sepsis, okay, which can be deadly. So prevention, what are the preventive measures? Well, avoid upper respiratory infections. You do this by avoiding contact with people who have colds or who are sick with other infections. Wash your hands frequently with soap and water, especially before meals. You want to manage your allergies. Work with your doctor to keep your symptoms under control. Avoid exposure to things you're allergic to whenever possible. Avoid cigarette smoke and polluted air. Tobacco smoke and air contaminants can irritate and inflame your lungs and nasal passages. Use a humidifier if the air in your home is dry, such as if you have a forced hot air heat, and a moisture to the air may help prevent sinusitis. Be sure to keep the humidifier clean and free of mold with regular thorough cleaning. Okay, so diagnosis, to diagnose sinusitis, they may have imaging tests such as CT or MRI can show your sinuses and nasal areas. These might pinpoint a deep inflammation or physical blockage, such as polyps, tumors, or fungi that is difficult to detect using an endoscope. Looking into your sinuses, a thin, flexible tube with a fiber optic light inserted through your nose allows your doctor to see the inside of your sinuses. This can help your doctor see a deviated nasal septum, polyps, or tumors. They may perform an allergy test. If your doctor suspects that allergies might be triggering your chronic sinusitis, he or she might recommend an allergy skin test. The skin test is safe and quick and can help detect what allergens is responsible for the nasal flare-ups. Samples from your nasal and sinus discharge, such as cultures. So if there are cultures, they're generally unnecessary for diagnosing chronic sinusitis. However, when this condition fails to respond to treatment or is worsening, your doctor may swab inside your nose to collect samples that might help determine the cause, such as bacterial or fungi. So again, what are the treatment options? Your treatment options are nasal corticosteroids, nasal sprays help prevent and treat inflammation. You might have fluticasone, triamcinolone, budesonide, mometasone. I'm sorry, a lot of these I work one all the time and I still can't get them, or methazone. If the sprays aren't effective enough, your doctor might recommend rinsing with a solution of saline mixed with drops of budesonide or using the nasal mist of the solution. Saline nasal irrigation with nasal sprays or solutions reduces drainage and rinses away irritants and allergies. Oral or injected corticosteroids. These medications are used to relieve inflammation from severe sinusitis, especially if you have nasal polyps, or corticosteroids can cause serious side effects when used long term. So they're used only to treat severe symptoms. Allergy medications. If allergies are causing your sinusitis, your doctor may recommend allergy medications. We have aspirin desensitization treatment. If you have reactions to aspirin that causes sinusitis and nasal polyps, under medical supervision, you're gradually given a larger dose of aspirin to increase your tolerance. Antifungal treatment. If your infection is due to fungi, you may have a antifungal treatment. Medication to treat nasal polyps and chronic sinusitis. So if you have nasal polyps or chronic sinusitis, your doctor may give you an injection of dupilumab or amlodipine to treat your condition. These medications may reduce the size of the nasal polyps and lessen congestions. They also may prescribe antibiotics to help with the sinusitis. You may receive immunotherapy, such as allergy shots and surgery. So in cases resistant to treatment or medication, endoscopic sinus surgery might be an option. For this procedure, the doctor uses a thin, flexible tube with a attached light to explore your sinus passages. Depending on the source of the blockage, the doctor might use various instruments to remove tissue or shave away a polyp that's causing nasal blockage. Enlarging a narrow sinus opening also may be an option to promote drainage. Okay, so some of the lifestyle and home remedies. So you want to rest to help fight off the inflammation and speed recovery. Moisturize your sinuses. Drape a towel over your head as you breathe in the vapor from a bowl of medium hot water. Keep the vapor directed towards your face or take a hot shower, breathing in the warm, moist air to help ease pain and help mucus drain. Warm compress. A warm compress on your nose and forehead might help relieve the pressure in your sinuses. Rinse out your nasal passages. Use special design squeeze bottles, saline canisters, and neti pots to rinse your nasal passages. The home remedy called nasal lavage can help clean your sinuses. Okay, so this is some very good information in regards to chronic sinusitis. And so I am going to close out this presentation of Health Matters. And I thank you for tuning in. You have a safe and wonderful day. Good day.